Time now for Better Health. I'm joined here with Asante's health expert, Beth Coker. We're also here with Dr. Timo Digert, who works with the Southern Oregon Cardiology. Today, we are talking about living with heart failure.
And Dr. Digert, the term heart failure sounds like the heart is no longer working at all and there's nothing to be done. What is heart failure and what causes it?
Hi, Beth. Well, heart failure, simply put, is just when the heart's not working well enough to do what the body needs. And it typically causes symptoms of shortness of breath, swelling in the legs, and in more advanced cases, it can cause low blood pressure and profound fatigue.
So what are some risk factors in patients that have developed heart failure?
Well, there are a number of different causes for heart failure. One of the most common causes we see in this country is coronary artery disease. So people who have had a heart attack in the past, for example, might be at risk for developing a weakened heart muscle and congestive heart failure. Other times it's inherited in families, or it can be associated with certain medications, like certain chemotherapy medications used to treat cancer.
Now, I think that your patients then arrive in your office with things like shortness of breath, and they're saying they just can't do what they used to. And Asante now has a heart failure clinic. How do you help your patients manage and live with heart failure?
That's right. Heart failure is a chronic condition that definitely can be managed. It's a big deal. It is a serious condition. It can result in hospitalization and disability and even premature death, but many of our patients do live a long life with heart failure. So the important things are really, we have patients who are engaged in their care, and the important things that we teach them are to watch their blood pressure, monitor their weight at home, limit sodium intake, and engage closely with their healthcare team. The other thing is we have medications that are extremely effective in treating this condition. Through kind of more structured, organized programs like the Heart Failure Clinic that we have at Southern Oregon Cardiology and Asante, we have a team of dedicated nurses, pharmacists, nurse practitioners, cardiologists, and other professionals really, working together to collaborate to really try to keep these patients healthy and out of the hospital.
So it's a team approach to help these people get back to life again.
Absolutely.
I think the two important things that you guys mentioned, even though it is difficult, you can live a full life with heart failure. Thank you so much. We'll be right back.